And hello to everyone at home. We're going to start with Michael Bilo from Motif magazine. Some preliminary research raises doubts whether recovered patients are immune or instead susceptible to reinfection or flare-up of residual infection. How does this figure into Rhode Island's planning, especially about ending social distancing and reopening the economy?
It's an excellent question. We had many policy discussions on that even just this morning because it's an ongoing learning as a country. We talk regularly with our federal partners, Centers for Disease Control and Prevention, other researchers throughout the country. Many of us are still learning what happens after someone has COVID-19. To what extent is someone immune to having future infections? How we are incorporating it into our approach is definitely the understanding that even if someone has had COVID-19, it is absolutely necessary to continue the social distancing requirements, the frequent hand washing requirements, and the staying home if you are ill again with anything else. That should absolutely occur. Definite key is that that should not change. We are working aggressively to better understand the serology or antibody tests that are out there, and we know that we cannot use just one mechanism to determine what works to open the economy. With the governor's guidance and thoughtfulness, we have many elements that are coming into play, and it will be one of several tools in our toolbox to help understand the best, the safest, and most effective way to move forward.
Our next question is for the governor from Matt Allen. Governor, you announced a partnership with other states in the region as a way to plan the reopening of the economy. Can you please expound upon what that partnership means in terms of obligations for the state? If faced with a decision that might be good for Rhode Island but not good for the other states, what is the direction you'll go in?
Thank you. So this will not involve any obligation for the state. This is I think of it as a working group. I've joined along with a half a dozen other governors in this region so we can coordinate our approaches to reopening the economy. I will always do what I think is right for Rhode Island. I will make decisions on the basis of what's happening in our state at that moment, and my guiding principle is how can I get the most number of people back to work as quickly as possible, as safely as possible. And our economy looks a little bit different than those other economies, so I'm going to make the best decisions for Rhode Islanders. Having said that, on the 95 corridor, there's a huge amount of traffic. We share the Amtrak line, we share a lot of businesses, certainly with us in Massachusetts, we have a lot of commuters, and so it makes sense that we coordinate and collaborate and learn from one another and have a joint approach. I'll also say none of us has ever done this before, and I mean none of us. So I haven't, none of the other governors hasn't, the federal administration hasn't. So I thought it was just the right thing to do, to have more smart people, more data, more guidance around this problem so we can learn from each other. It won't obligate us, but it's going to make sure we do a better job for Rhode Islanders.
Christian Winthrop of Newport Buzz asks, when you make the decision to start reopening the economy in Rhode Island, which sectors do you envision opening first? Which sectors will be among the last? What new rules do you anticipate for the restaurant industry?
Great question. So here's the way to think about it. As I've said a few times, there's not going to be a magic reopening, flip of the switch of the economy. It's not like we'll pick a date and everybody goes back to work. It's going to be incremental and targeted and industry specific, and there'll be new regulations per industry. Obviously, the industries that can come back online sooner are ones where they don't rely for their business model on lots of people being close together in small areas. Hospitality, restaurants, conventions, those are the businesses that will obviously take the longest to be back online. Regardless of the business, all of us are going to be living in a new normal, whether that means wearing a mask, working in shifts. Everybody should still be working from home whenever possible. We all need to start to realize that for the next year or so, we're going to be living under a new set of regulations. Again, my goal is most number of people back to work fastest at lowest risk. So we'll go industry by industry. How many people are out of work? How many people can we get back to work? What does that risk look like? And what are the regulations that have to be in place? And we're hard at work on it now. And when we roll it out, it's going to be a big, big change for everybody, but it's the only way we can get people back to work, which is, of course, the goal.
Richard Asnoff of Convergence RI asks, what kinds of coordination is happening with community health centers in regard to testing?
We have an entire team of people who are focused on accessing our vulnerable populations, as well as people in core communities who may not have the ability or the time to be able to travel out to the drive-through sites. We very much appreciate our partnerships with community health centers to be able to tap into the resources embedded in our communities. We are also working with our health equity zones, especially ones connected to our federally qualified health centers, where there is already a ready-made infrastructure designed to engage with members of the community who need assistance or who want to be able to access this resource. So work is being done to accelerate that so that we can make sure we are accessing every aspect of Rhode Island's population for the expanded testing approach that we've taken.
The next question is from Ian Donis. How many tests need to be done to make decisions on opening the economy, and when will the antibody testing begin?
Thank you, Ian. So I'll say this. I'm not sure we need to be doing very many more tests a day than we are now. So if we're at over 2,000, I'd like to get to 3,000. When you're doing 3,000 tests a day, every day, per million population, that is an excellent place to be. What we will look at is, how many positives do you have in a day? Is the rate of positives over a period of, say, 5 days going up, going down, or steady? How many hospitalizations do we have in a day or over the course of a week? Are we still, how long does it take for us to double our hospital population? We were at a place of doubling our hospitalizations every 4 days. So that is much too rapid. So the testing, numbers per day is in a great place. And we're going to continue, as Nicole said, we're going to do more in inner cities, more at nursing homes, more in congregate settings, but we're about where we need to be. With respect to the serology test, we are weeks away from that. We are right now in the process of figuring out which test to use. As Dr. Nicole said, you probably have to do more than one test for accuracy if you want to be able to rely on the test. And frankly, we have to try to get our hands on the tests. They will be easier to get a hold of than the reagents and testing equipment that we have now. But we are, 3-4 weeks or more away from having kind of widespread serology testing.
Next question is by Steph Machado of Channel 12. Yesterday's new Goldman Sachs loan program stopped taking applications before many small business owners even had a chance to hear of it. Clearly, there's a high demand and the federal loans are delayed. Is there another state program coming?
So thank you, Steph. Yesterday at this press conference, I announced a $10 million forgivable loan program from Goldman Sachs, and by the end of the day, it was depleted. We ran through the entire $10 million in a day. So I am, as you might expect, trying to expand that. I don't have anything to announce today. I'm working hard to see if we could convince Goldman to give more to Rhode Island. I'm also expecting the federal stimulus to be coming at some point soon. So the short answer is yes, I'm hard at work. I don't have anything more to say now. I do know that Congress, I have been told that there is bipartisan support in Congress and by the Trump administration for expanding the federal SBA payroll protection program. It hasn't happened yet, but I think relief will be on the way in that program as well.
Steve Alquist of Uprise, Rhode Island, says the George Wiley Center asked me to ask you if you are planning on issuing an executive order similar to the one recently passed by the governor of Michigan, allowing for the restoration of utilities without any down payment.
Yeah. It's something I might get to. Right now, there's no need for that because, as I just announced, utilities cannot, by action of the PUC, be turned off. So I feel good about where we are, and people should feel confident that their utilities can't be turned off.
Brian Amaral of the Providence Journal asks, you said 2 weeks ago that 5 million N95 masks and 3 million surgical masks were on the way to Rhode Island. Did they arrive? Are hospitals still facing possible PPE shortages? Some
have arrived, thankfully. Most have not. A lot of this very complicated getting them here from China, from all over the place, but many have arrived, so we're in much better shape than we were. Do hospitals have shortages? Not, for the most part, no. So on any given day, they can get through the day, they have what they need. The challenge is making sure that they have several weeks' supply on hand at any given time. We're also looking into better ways to sterilize masks. So yesterday, FEMA indicated that every state would be receiving equipment to do mass sterilization of masks, which allows us to safely reuse them. We're teaching clinicians and healthcare workers how to safely reuse the PPE. So I would say we don't have everything we need. I wish I could say we had 30 days supply on hand now, but it's not a crisis, and we are managing through it, and we certainly, everybody has what they need in the hospitals to do their job a day at a time.
WPRO's Steve Klampkin asks, do you agree with President Donald Trump's assertion that he will control when the states will reopen for business?
Look, I think the governors were the ones who had to make the tough decisions to close the economies of their states, and at the end of the day, we'll be the ones who make the tough decisions about reopening. We will do that in consultation with one another. We will do that in consultation with the White House. Most of all, we will do that on the basis of facts and science and evidence and what we know to be the right thing for our states. So I think you've seen governors lead through this, and I expect that that will continue.
Bill Bartholomew asked a similar question. Per President Trump's statement yesterday that he has total authority to reopen the economy, what is your administration's position on which level of government should have such authority?
Yeah, I think I just answered that.
Next question is by NBC 10 News. What do you think about President Trump? We're going to skip right ahead. Michelle Smith asks, what's your current goal for testing in Rhode Island, and what's preventing the state from reaching that goal? Vice President Pence and Dr. Birx said Monday there are millions of tests, but they are going unused because of a lack of coordination. Does that match your understanding?
Not here in Rhode Island. I was on the call when Dr. Birx and the Vice President said that, and that is, maybe that's the experience of other states. That is not the experience in Rhode Island. Also, as I said, here in Rhode Island, we're testing over 2,000 people a day. On a per capita basis, we're doing among the most testing of any state in the country. And again, great thanks to CVS. So there's more to do, and we have to get to hard-to-reach populations, and we certainly have to be doing a better job in our nursing homes and congregate care settings with mobile testing units. But the National Guard and CVS and the Department of Health, hospitals have gotten us into a good place on testing. The thing that I do need help with, and I need more help from the federal government with, is continuous supply of the reagents. So we have the equipment, and at the moment we have the reagents, but the supply of reagents is still a challenge. It's a challenge for hospitals here, and that's something that we just all have to struggle through.
Our last question for today is from Alan Gabberty of WBOB. He writes, there is a rumor going around that the Department of Health or the governor has banned the use of hydroxychloroquine to treat COVID-19. Could you clarify?
I can certainly clarify. We want hydroxychloroquine to be available to people who have COVID-19 in the appropriate situations where it is needed. I've shared previously that we coordinate very closely with our infectious disease providers as well as our critical care doctors. There are specific hospitalized situations where hydroxychloroquine is absolutely worth administering to see if that will help patients improve. We are fully in support of that happening. We want to make sure that hydroxychloroquine is used in the appropriate settings for COVID-19 and reserved for the previously FDA-approved reasons that hydroxychloroquine is used for, so that the patients who depend on it for their functioning and health still have access to that as well. So we want both paths available, both being done in the appropriate ways necessary for the patients.